clinical oncologist. For people who don't listen and watch last week, when you say clinical oncologist, what are specific work you do in the hospital?
All right. So when you say a clinical oncologist, now somebody we don't train for treat cancer by one medicine, when I call a chemo, or we call them, of course, immunotherapy or hormone, and drugs for treat the cancer. That at the same time, the person also trained for treat cancer by a particular process we call a radiotherapy. Now, like a machine where they produce radiation, where you know this year, but if you don't know like a bullet, so they will kill the cancer cells so that the person will free from the cancer. So now that thing where you put together, now your specialty. So now that one I go train for, and I mean I specialist in that.
So from Bulem, you really watch and listen, we don't say, now master sabi somebody this inside for treat cancer business. So in they can talk about what we call breast cancer, but now we can call them bobby cancer. So for doctor, for in a general term, who say breast cancer, that cancer will come on a person bobby cancer. What do you mean?
All right. So normally the breast, now something we get your function we they do. Say they now the front part of your chest, we na two. One day at the right part, the other one day at the left part. All right. So that breast day, it actually they produce a substance called milk. We that one in the head for let of course give food to picking where you don't born you as a cumbra or you will don't give birth to that picking. You get a lot of things inside where they make that picking they grow healthily. Okay, but at the same time, they make you be a woman. That is, even though man themselves we get breast cancer, but like for woman they can make them beautify. All right. So ideally, that breast again your normal tissues inside. What I mean, the thing that we got put together for them make up. No other thing for the inside. Any other thing can inside now sickness. Either if it be a mass, that mass is could either be a cancer or another thing. So if a particular thing grow inside the cancer, inside the breast, we like a mass. But that mass, the last time, if people can remember, we have talked about a mass we call a tumor. We will say tumor or something where they grow. Okay, now like a lump. Okay?
That lump like ball.
Exactly. So when it grow inside the breast, it's not supposed for the day. Alright? It's not supposed for the day. When it grow, they get tendency for move from that breast, go other part of the body, na cancer.
Okay, so you don't tell me that they say that cancer now we lump go inside woman in body or person body and go other part of the body there. Okay.
And not forget again, if you with a man that we serve, we get breast tissues. So man said he gets breast cancer. But the percentage we man can get is very small, about 1% compared to woman.
So at the cancer side. Yeah. So I want firstly categorize up. Who are the category of people that we prone forget where they get breast cancer. Okay. Who knows say prone? Who are the category of people that we can get breast cancer?
Alright, so that brings a particular topic we call like risk factor. Okay? If still with the listeners, I can remember last week when I present on, I say the real cause of cancer, nobody don't know. But things a day when they happen to you or what you go do will make you get the cancer. So for breast cancer, it gets your specific thing then where if you don't have what happen to you, you will get the breast cancer.
So you want to say bobby cancer back the year two they make it happen, nobody know.
No. We call them we just with a cancer and the cancer cancer, the real cause is idiopathic. Also idiopathic, nobody know. Okay, but things and the way they happen to you or what you do, it will make you develop the breast cancer. So one, now like age, as you grow older, there is tendency for let you develop breast cancer. Okay? Specifically between the age of say after 30 or 40, as you grow older, the risk is there. Okay? Two is if you expose yourself to hormones, a particular hormone inside your body.
Let's say hormones, what
yeah, now like a chemical way now like it creates a signal to your body for let do a small work there. So one of the hormone where they play very great role inside and I will call it estrogen. Okay? If you expose yourself to too much of that estrogen, it will make that breast tissue tendency they follow the cells and become cancerous.
So how somebody they expose himself to that estrogen?
Fine. So one, now like if you get at the very early age, you begin see menses. Ideally, when pikin don mature, they get menses between 9 to 15 years, you will begin see period. But when you begin seeing period before, now and then a risk in the long run for late develop breast cancer. Okay. The other one is na late menopause. Who say late menopause? Now the time when you reach for like stop foresee menses. Okay. Again, if you late, ideally inside salon, I think on average now at age of 48, when you don't reach 48 years, they begin see that kind of signal, so you don't reach time when they see period again. But mostly it dey between a range from 45 to 55 years. Right? When you late for reach that age, for reach that particular age for stop for see, definitely you get a risk for them develop breast cancer. How? Because at that early age, where you don't, let's say between 9, as this one say 9 to 15, you know, this hormone still at the talk about this estrogen. As you reach that maturity stage, you begin see your menses. That, of course, I would say the estrogen activities. You understand? It's like you don't come quick, you don't begin. As you begin see menses, that estrogen they begin play in your body, and it will begin now like it will increase in level. We are in the tissues away inside the breast. Tendency for let it become cancerous. Okay. The same thing too when you reach menopause, but you late, you will already begin get the estrogen in the body. But as you reach menopause, that level of that estrogen can reduce. But imagine you take time, so still the estrogen, the level they up. So there is tendency if they go trigger the cells and for let it become cancerous. All right, and take note say the breast inside, then there's what we call receptor where that estrogen they go bind to. Another they will call it progesterone. Okay, the other will call it HER2 new. So that the day now then they play very great role inside breast cancer. In fact, now then we use mostly one categorize breast cancer in terms of molecular level. Okay, so those are that now one way down there where they make you expose yourself to hormone, whether the estrogen. The other one is obesity. If you get too much of fats inside the body, because that same estrogen you store inside your fats in the form of estradiol. So if you get too much fat, you store more of that estrogen, and when you store more of the estrogen, you they expose yourself definitely. I mean, you get a risk for developing breast cancer. All right. Then the other one are contraceptives. Then pills and what we see particularly the monotype, the tablet.
So our breaker now contraceptive.
Yeah. So
which is very common.
Yeah, family planning.
Yes.
Specifically the tablet when are monotype, when are more of estrogen normally contain.
What is a monotype? Which kind of tablet?
And most of the contraceptives there are two type of like a hormonal theory they put together. Two types of hormone. Of course, a chemical when they put together, they make them. But you get some that are just one are like estrogen. So imagine you get estrogen, you take tablets, you don't get estrogen, you put more. And you remember what I say when you expose yourself to more what hormone, that are estrogen, you get tendency forward. So if you take contraceptives, when are that monotype, especially the one we contain estrogen, definitely the chances, especially when you take 5 years consecutively, not to that one way you went cut. You take consecutively up to 5 years, the risk is high for let you get breast cancer. Then another one again is
so that only under because woman themselves they watch and they listen this particular program where you don't say contraceptive, that monotype. How that woman will want to take contraceptive? I for able identify say this contraceptive na monotype, now not take them because at the long run I know I expose myself for that get breast cancer.
Okay, so this is a very big advice to we sister. When you want to go into contraception, you understand? I think we get organization where they in charge of that. Yeah? We call it PPA. So the people educate you. Normally, if you do some blood tests, they check your hormone level. The one will fit you, and they give you. Not to that one where you go buy and they say they go to pharmacy. Yeah, why this medicine I sell and give me? You don't know whether that particular medicine, this particular type of what hormonal driven contraception they get. So at the end of the day, it cause more problems. So these are the reasons make way. In fact, you see some of the sisters, the lot of contraception the way they can do. In the long run, they can get problem with bonds or some other problem can come inside. So that particular issue of risk for letting get breast cancer, I want make them very more be careful. At least if you want to go into contraception, it's good for letting you prevent yourself for letting you get early unwanted pregnancy. But take your time. go to hospital or go to the appropriate side, may they educate you. They always fit you, they will mark out for you. Okay? So the other one is going to make you estrogen or your hormone will be exposed to where the estrogen specifically. Now like where you don't reach menopause. You know where we sisters there with mama then, you know where they can reach menopause. Where then I know the day what it can happen, they can get a lot of things that can happen to them when they don't want that. They can get hot flush. They, you know, they can just feel some ease. The body can be warm, you know what I'm saying? Then behavior not okay. They really can know say something they go wrong will not be happen to me. So some of them will understand. They can go back to doctor. Doctor, why they inject me with a particular this particular hormone drop so that we will make come out of this kind of thing will happen to me. Because during the time when you did in the premenopausal, where you didn't see menses, that hormone, where I don't tell you about the estrogen, the progesterone, then there is another one called prolactin. They get a lot of FSH, LH, they get a lot of role in the play during menses, childbearing, and then menstruation. So when you don't menopause, the level they can change. And when they can change, and then the problem can come. The woman can complain a lot of things. So some man can go to the doctor and say, inject me with social hormone so that this thing will happen to me, hot flush, and they feel hot, and they feel unease, left out. When you do that, you expose yourself to breast cancer. So then the hormone, then the exposure to hormone, okay? Then another thing is when you expose yourself to radiotherapy, okay? This is chest here. You all the time you want to do chest X-ray, you want to do X-ray, you want to do X-ray. You expose yourself to what? Radiation.
So anybody really go for good do X-ray pass mark?
Yes. Especially to the chest.
Especially in the
to
chest.
The chest, yeah, there is high tendency for them to develop breast cancer. Okay? Then the other one is if you don't get breast cancer on the one breast, let's say the right, they don't treat her. Risk again for them get a day, for them get an day, or the one at the left.
Why?
Yeah, because now you risk one, the two breasts they communicate. Okay? They communicate by what we call lymphatic drainage, particularly between the mediastinum here. Okay? So maybe sometimes during that time, some cancer we don't move, it don't pass through that lymphatic system, it don't go on the other side. So in the long run, a cancer they can't be it's not the last time. It take time for them to develop. Okay? So getting one breast, let's say right, it's a risk again for them to get her and the other parts. Okay? Then another thing again is alcohol, cigarette smoking. Now they own a risk. Okay?
So how alcohol and cigarette smoking they increase the risk for the person get breast cancer?
Okay, I think I explained that one the last time during the.
And for general cancer, now
yeah,
breast
general.
cancer.
So breast the same thing, you know, cancer are cancer. Okay? Now abnormal growth of cells, so they lead to mass. You know, in we cells we God make our body, we get what to call nucleus. In the nucleus, there's what to call DNA. Then DNA is made by a molecule. Now something come together, God put together and make them. So that structure is enough for change. Okay? Enough for change. When you dey smoke, there is high chance you dey put chemical in your body where they go attach itself or you go display one of the molecule where they put that DNA. And when you do one, definitely that cell not to normal cell again. It can behave anyhow. And when cell they behave anyhow, it will grow anyhow, it need to stop in the way they call it don't lead to a tumor. And if you lead to a tumor, it might possibly say now a tumor where they spread, they go other side for cause problem. Where that particular feature they na cancer. So the same thing, the same thing goes for breast cancer. Okay, because they share a common feature. They all cancer, whether breast cancer, skin cancer, cervical cancer, prostate cancer, they get a feature where an umbrella where they all share, we call it hallmarks. When are characteristics. One of the hallmarks is they spread. Two is when they get that signal for for divide, they forever divide, they need to stop. Three is they refuse to die. Four, they escape with immunity. So the body they see for them, now they come up for them to survive. Okay? Five, they get that genetic instability, where in the other part explain to the DNA. Then they get up. Alright? Then there are other features that we come together, but the one they don't list, those are some of the common one where they all share together. And then feature they make the cancer. Alright, they make the cancer because they're not there like normal cell. With normal cell made up of nucleus, cytoplasm, organelles, and cell membrane. The cell we put all together and everything they go on normally. When that cell don't become abnormal, it can do whatever behavior, you can do whatever sickness you can call. And normal most of the time, where that can happen, cancer can inside. So like that.
So, doctor, Fambul, you already watch this program and listen to, and this program now waiting the doctors when they come to you from SLVC TV and Radio FM 99.9. The number where you will send text message to 076 577260. Today topic we talk about breast cancer. Doctor, you all of the risk factors that we don't give. Now for somebody we most times we don't reach menopause stage. We don't say don't pass 48 going to 50. But from research we do somebody we even when a young person can still get breast cancer. So waiting they make land they happen.
Yeah, so I'll not be done for this the thing the way they make. The other one is now inherited something. If your family, somebody we don't get cancer, particularly the first degree, mama, we don't get cancer, there is high chance you said you get. Not necessarily say you will get, but I risk for they say get. Alright? Then at the same time, other things they want list like smoking, alcohol, you understand, eh? Don't they all now they can risk way they put together, radiation where you expose yourself to. Then maybe this person here we don't even get other cancer where they don't treat our chemo. Particular chemo in day where we call them of course anthracyclines, okay? When you expose yourself to that, instead there is tendency for you to develop breast cancer. So you don't necessarily say now no more when you reach menopause or when you get your menses earlier before we call it menarche. You understand? Down there they no more. Now like the one list now they make you expose your hormone level they increase. And when you increase, definitely the breast they get an issue. And mind you, that are very important aspect that the other people they understand. Because the breast, like I said earlier, that receptor with inside, when would they even try for assess you for running, you walk up for them try for stage you cancer and put into category so that at least we will know the appropriate treatment will give you. Now then receptors will they check for the back inside your breast.
So
right?
Doctor Oliriana, you make mention say because breast cancer we plenty of we know say now woman they get breast cancer. Now you don't talk and passively say man self they get breast cancer. How? Why?
Yeah, man they get breast cancer because we say we get breast tissues. And you don't necessarily say you they see menses. No, man only do that. But maybe it's not possible they smoke. Or maybe it develop abnormal gene. Specifically there is this we call BRCA1, BRCA2. The last time I measured that particular gene when I do this presentation. So when you inherit that abnormal one, definitely there is a risk for it to develop.
So if you get them from your papa or your mama,
yeah,
there's a risk for it
develop breast cancer.
Wow.
Yeah, but the percentage for man is very small. Like just out of 100, 1% of men that can normally get breast cancer.
So we know so we get different type of breast cancer then. But in Sierra Leone, from your experience where you don't treat people who get cancer, whose type of breast cancer is the one are the most prevalent in Salone?
Okay, I think normally it can also go to in the world. But Sierra Leone, the can't be say earlier on. Really, we don't get that kind of data. We don't do research. We get that kind of data with the pinpoint say this are the common type of breast cancer. Mind you, the type of breast cancer we normally you can normally see, we can happen to woman then or any man then. The breast made up of the nipple. You understand? That nipple they get a connection at the neck part to go, a form what to call lobus and ducts. So that lobus and ducts, now they mostly the breast cancer can start. Alright? So if now the lobus is start, we call her lobular, carcinoma. If like the duct, we call that ductal carcinoma. Now it depends on to something they will surround that particular gland or toward or that particular structure I don't call so. If the cancer penetrates through it damage that basement membrane, it begins spread. That we call it invasive. But sometimes it can just grow within inside and then it break up. So it can grow inside. So that one they bring different categories of breast cancer where which side it starts, then how it behave, where it grow. Alright? Most of the time you can see again, apart from inside, the nipple parts where the person will tell you say they get swelling they will go around the nipple. I see what are the commodity, That one day now breast cancer but at the nipple. So specifically the name we call it Paget disease. Most of the time, okay? So that Paget disease of the breast. So instead of breast cancer, now that time. Right? All that time the day, but that one day now more of academic. If we go into a deep down. But for me listeners, people that do not go to school, I mean I don't want too much way to then get deep conversation.
So doctor, breast cancer, a bad sickness?
Like I say, cancer in general is bad, but breast cancer, honestly, when you present with an early, it gets complete cure. And one thing with breast cancer, it's very easy for you to detect. You say self.
So they can't understand
Yeah,
symptoms,
yeah,
but I just want to follow you paint a picture
Now
of whether breast cancer and a bad
it's
sickness.
bad if you allow it progress.
It kill?
It kill. Why make it kill? Because it is spread. And the common side the way it is spread go, 1, now your lung, 2, the liver, 3, the brain, and 4, the bones. So imagine your lung, it dey follow you blow. Cancer go inside. It go disturb the breathing, processes. So at the end of the day, you begin deprive of oxygen where you supposed to take in for you at least you live well. The same thing to the liver, you get a great role in the play. If cancer go inside, you go begin disturb the normal functioning, you will get problem. The brain, you will get problem. The bone, you will get problem. Okay? So that is why it's bad if you try for allow for let it progress, it reach to higher stage. But at a very early stage, we can solve the problem, at least we free you from it.
So as a doctor, you know somebody wey na master sabi person for body's cancer business here. So what are the common signs and symptoms where sometimes that mommy go sit down her house now, or that grand pikin go sit down her house, or sometimes that guy or me self I go for watch myself and say, oh, this I don't see this there, so now go to hospital, but I go check if I don't get breast cancer.
So we just took out early symptoms and then late. The early symptoms, when the cancer don't start at the breast, now lump force you notice. It's like mass, you get that lump. And the lump most of the time is painless. You know pain at all. You know they harm you. But you will take and see now just something minor. So if you allow that it grow, it begin grow, what did happen? It begin occupy space inside the breast. And as it occupy space inside the breast, it change the structure of that breast. What they can inside that one, you will begin notice the body, the nipple, they begin discharge water and blood. Okay? Then 2, you will notice a tension of being inside the breast. You will find out say pain. The patient will complete pain. Then the cancer will continue to grow in that it they begin affect the skin, sore. You understand? In the canal the way they call. Then sometimes before they saw the skin itself, the appearance, there is what to call you see orange, the skin of the orange. You get dot inside. Yeah. So that kind of structure of the orange insect it presents like that, but we call it pure orange. Now skin of an orange. Now an sign it tells you this particular breast cancer. Okay. Then another thing again is the nipple. They go inside, and like we call it nipple retraction. All right. And at the same time, they notice the engorgement. They notice the building of the tension. They lead to ulcerations. The color of the skin of the breast become what inflamed. You see, as if there is we call them how do we call it? We in a simple term say inflammation will occur around the breast. You understand? So that the day and the
so
features,
you say inflammation will occur around the breast.
Yes.
What do you mean?
Meaning the skin will become, let's say, red. Okay? Then most of the time you can get that kind of dots by the skin of the breast, and at the same time you can notice the skin sometimes can even start to develop what sore, where they lead to what ulcerations.
So doctor, from that thoughts the first way you don't give me say because say for especially boy picking, when they begin reach that maturity stage, they begin feel like say seed vein like bobby. You understand? So is it the same thing for cancer when somebody want to detect them?
No, it not be the same. So in fact that brings me to for tell the family they say the best time we can find for you assess your breast. You understand? Particularly woman then we don't for mess. You don't reach maturity. We don't for mess after 3 to 5 days. That are the best time. No assess your breast during the time with the mess or before that.
So how will they assess the breast?
Now you of course you know say the breast, why the breast are, not know this like a seed or not know this like a mass. You understand? You can start, you go clockwise or you can make anti-clockwise because the breast you can divide into quadrants. You get the upper outer quadrant, you get the upper inner.
What is a quadrant? Because that possibly what I mean.
Now the category. So like if you take a line like this, it pass through the nipple, another horizontal pass through the nipple.
So if you
divide the breast.
If you divide the breast into
to four parts, yes.
Then you into that 4 parts, then you touch them.
Yeah, you touch them. Yeah. You make sure say all them 4 parts, then you touch with the right hand, then you touch middle. Okay. So when you do that, you notice there is nothing like lump or there is nothing like a mass, meaning you are free. But when you detect anything like that at the early stage, make sure say you report.
So doctor, what are some of the common complications, that we breast cancer they carry?
Okay. So like I say, the complications, if you allow the breast cancer for escalate to go to higher stage. In general, before normally we treat you with the stage of cancer of the breast, a day from stage 1 up to stage 4. The stage 1, it gets subdivision. Stage 2 gets subdivision. The same thing to stage 3 and stage 4. So how the cancer they grow, how it they can involve by the nearby structures or tissues, now so with the stage 1. If you allow the breast cancer go from that, the cancer come out from the breast, it go inside the lung. Definitely, you go call complication. What it will make the able breathe well. You want your lung gets a lot of function for let you make you breathe well, get oxygen, pull out carbon dioxide. Okay. The same thing to the liver. The liver gets a lot of function they perform for. You allow the cancer to go to the higher stage. You know with stage 4. If they go cause that liver, not for work fine. The same goes to the brain. You allow the cancer to go to the brain only function well. And most of the time, we can detect the cancer if you don't go to the brain. Clinically, the patient can convulse. So back can convulse, and at the same time, if you do a CT scan, you see the particular metastatic breast in the brain. Okay, the same to the bone. If you allow go to the bone, say the backbone or any other part, that bone they get tendency for it broke. Okay, because you go weaken that bone there for let get strength, so it will grow. So those are the complications. Then the worst of it, they make you die.
Okay.
Yeah.
So Udoyeri from Dr. Ibrahim Kemo Sise, a clinical oncologist that is here on China Friendship Hospital inside Jue. We don't the help for home months on this topic, breast cancer. Family program where you watch and listen to now, waiting the doctors where they come to you live on SLBC TV and Radio FM 99.9. And the number where you go send the text message to 076 577 260. Well, we go for a short break. When we return, the program will continue.
Understanding breast cancer. Breasts are made up of fatty tissue. They contain small chambers called lobules where breast milk is made. The milk travels through tiny channels called ducts to reach the nipples. Lymph nodes are located inside your breasts and under your arms. They are connected by lymph vessels and they help your body fight disease. Breast cancer occurs when healthy breast cells become abnormal, grow out of control, and form tumors. Breast cancer can sometimes spread to other parts of the body. About 1 in 8 women have a lifetime risk of getting breast cancer. For men, the risk is 1 in 1,000. Breast cancer that develops inside the milk ducts is called ductal carcinoma in situ, or DCIS. When DCIS spreads into surrounding tissue, it is called invasive ductal carcinoma, or IDC. Abnormal cells can develop in the lobules of the breast. They are called lobular carcinoma in situ, or LCIS, and are not cancer. When these cells spread into surrounding tissue, they become a cancer called invasive lobular carcinoma. Signs of breast cancer can include a lump in the breast or armpit, a change in breast shape or size, nipple changes or discharge, and skin changes including redness, inflammation, or dimpling like the skin of an orange. Risk factors for breast cancer include older age, dense breasts, having breast cancer before or having a parent or sibling who had it, having specific inherited gene mutations called BRCA1 and BRCA2, having Ashkenazi Jewish ancestry, drinking more than a small amount of alcohol, and being overweight or obese, especially after menopause. Screening for breast cancer can help find cancer early and save lives. Screening includes examining your own breasts, having a healthcare provider examine them, and having an X-ray of the breasts called a screening mammogram. You can check your own breasts about the same time each month. Feel each breast and armpit and look for any of the signs of breast cancer previously discussed. A diagnostic mammogram is used when a change is seen on a screening mammogram. It includes extra detailed images of the breast. A breast ultrasound is often used to determine if a suspicious lump is solid or fluid-filled. A fluid-filled lump is often benign or a cyst, while a solid lump can be cancerous or a benign fibrous growth. A breast MRI shows more detail than a mammogram and is often used for very small masses or changes in the breast that cannot be seen by mammogram. A breast biopsy is a test that removes a few cells or a small amount of tissue from the suspicious area in the breast. There are various types of biopsies. A doctor called a pathologist will analyze the breast biopsy tissue by looking at the cells under a microscope and doing specific tests. Their report will let you know if you have cancer and if it grew because of estrogen, progesterone, or HER2/neu protein on the cancer cell. The results of these tests help your doctor choose the right treatment. Doctors classify breast cancers based on how they behave. This includes non-invasive, cancer that has not spread outside the tissue where it began; invasive, cancer that has spread and invaded healthy tissue; recurrent, cancer that returns after it was treated; and metastatic, cancer that has spread from the area where it started to other areas of the body. Common types of breast cancer are invasive ductal carcinoma and invasive lobular cancer. Less common types of breast cancer include inflammatory breast cancer, tubular breast cancer, colloid breast cancer, and metaplastic breast cancer. Triple-negative breast cancer means the tumor has no estrogen, progesterone, or HER2/neu protein receptors on its surface. Triple-negative disease may have a worse outcome and often requires more intensive treatment. Breast cancer staging is determined by the size and location of the cancer and whether it has spread to other areas in your body. Breast cancers are graded 1 through 3, with 1 being the most similar to normal, healthy cells, and 3 being the most different from normal cells and the most aggressive. Breast cancer treatment depends on the type and stage of your cancer. You will need treatment from a cancer team specializing in different areas of medicine. The main treatments include surgery, radiation, chemotherapy, hormone therapy, targeted therapy, and combination treatments. Common types of surgery for breast cancer are
Well, welcome back. The program where you dey watch and listen to now. Waiting the doctor say when they come to you live on the SLBC. I hope so we don't watch and listen to that video. We don't give you small education about breast cancer. We don't really understand small thing. Well, we still get with Dr. Ibrahim Kemosi say when a clinical oncologist now the Sierra Leone China Friendship Hospital inside Jue. Doctor, we don't get some messages. We don't get some of our messages. We carry them for the doctor answer to some of the questions and we don't ask. Well, I start with this first message from Lady P. We say, what are the challenges breast cancer patients face in the country? So, doctor, this Lady P they ask, what are the challenges where breast cancer patients they face inside salon?
So I think one of the challenges are the awareness. They not to understand it about the breast cancer fully. And that the challenges where normally you will encounter, if you allow the breast cancer for go to higher stage, you complicate and so much for treatment.
So now how many stage we get by this breast cancer?
So like I said earlier, we get stage 1, stage 2, stage 3, and stage 4. Okay?
So stage 1, what is stage 1 mean? I only explain the stages.
Stage 1, now the size of the mass, the cancer within inside the breast.
Size of the lump.
Yeah, the lump here within inside. Normally now less than 2 centimeters. Okay? Stage 2, now between 2 to 5. Stage 3 it dey between let's say, or let me just say, depend on the T, we call TNS staging, where the stage, where they take for each stage of cancer. That the tumor size, the lymph node involvement, and then how far it don't spread. Okay, but you know, putting the stage together, putting those things together, you go get your stages where they put. Like for the T staging, where now T1, T2, T3, okay, up to T4. Now based on the size of the cancer, we don't grow. If at T1, it is between very small, about 2 centimeter, less than 2 centimeter. T2, it is between 2 to 5. T3, it is above 5. Okay. Then for the T3, now we are in, it don't begin the spread around the nearby tissues. T4, it don't go. Like you don't go either at the lung, the brain, the bone, or the liver. Okay. So if you detect earlier that lump inside the breast, you detect that earlier, the mainstream of treatment is surgery. Now for let them go remove that particular lump with a very clear margin. What say clear margin? So that tissue where they remove, that healthy one, when they check out, no cancer, no for day pipe, meaning that surgery they don't have properly. Either this is a lumpectomy, they remove the lump, or they remove the breast itself. So the issue where they get is when you allow the cancer go further, the treatment will be more complicated. One, you will need surgery, you need chemo, they need radiotherapy.
So doctor, you don't say, so the most effective treatment for cancer, apart surgery?
Yeah, one of the mainstream is surgery. We remove. Why make it?
So for example, if I find out, say, if it's one woman who don't have now, the coach you don't talk so, then after a menses, after 5 days, you go check him, but there find out, say, get small lump, you don't feel small CD, you go to hospital. For later to solve that in the past, then do surgery.
Yeah, you for remover. You get for remover, and when you test out for this in a cancer, you for make sure see that margin, we say you pull out, you don't have no cancer there. But however, when you remove the lump, or when you remove, let's say, the breast, you check for say there is still some of the cancer left inside. You can advise the surgeon for go back and remove, or you add further treatments when like chemo, radiotherapy. You can add on it, or we call it targeted therapy. All right, but all that one depend on the stage of the cancer. We get what to call their database, evidence-based treatments when are then we use based on the stage of the cancer. So that evidence now something way they don't do research, work, and now we use.
So this brings me to the second question with this person, Kathleen. He say, what should someone do if they discover a lump in their breast?
Okay, so at the advisor person, they let you go. They go check them before that particular lump. It means they get any relation to cancer or not.
So not all lump na cancer?
Not all lump na cancer. So lump the day, not to cancer, not just a tumor, but a benign. Now just the fats wey dey inside the breast, now don't they grow, or the cell don't they grow, but it no dey cause any further spread. Or it will possibly say, like mass we get water inside, we call a cyst. Okay, like mass also without the not to cancer. But any lump we get tendency, when they look at microscopically, when they remove them, they will send out to a specialist who call a pathologist. He have to watch. We watch and they describe the nature of the cell. And if we describe the nature of the cell, they have to say fall in, say now cancer of the breast, meaning in treatment look different from that we know to cancer.
So this next question, this person, they say, how common is breast cancer in Sierra Leone?
Okay, so again, I still say this, we not get that kind, we know it actually common, but we not get that kind of data base where I will tell us specifically in a so percentage. You understand it? On a so incidents we actually did say we not get that kind, we not do that kind research it. So maybe this time
even though we not do that kind of research, from your experience, we not only treat people for breast cancer, they get plenty cases of breast cancer.
Yes, when they get them, and most of them when they get them, they cannot advance. They cannot do stage 4.
So most of the breast cancer cases then like on the stage 4?
Most they are stage 3, stage 4, because they don't wait. Some don't go for that country way, some don't wait first, You know, we don't know whether if not because of shy or afraid. And honestly, when you get a cancer of the breast, not to death warrant. You understand? Not to death warrant. Especially at early stage, you get cure. It's cure for you.
So this person they say thank you doctor for the cancer education. Can men also get breast cancer? This mommy inside Kisi, maybe in just the joint where I ask this question.
Yeah, man say you get but the proportion are just about 1%, very small compared to women. Because we will not get that kind with hormone, the hormone will be tell you about that estrogen. You know, but we inside me compared to man. So the issue we still get to, but the tendency for they get breast cancer, the percentage very small.
So this other person they say why is it that people who do frequent X-ray at high risk of cancer? John Cisse they ask this question.
Okay. So radiation are something we not good when you expose yourself to plenty, because the way it work in the pass through your body, it enter inside the body cells. When it enter inside the body cells, the cells they can be say earlier inside the nucleus we get what we call DNA. Now two double strand, and they go damage that DNA. It go damage it. And when you go damage it, sometimes during the process of repair, the cell not will repair properly. You understand? Some can repair in abnormal form, so it will lead to cancer.
So this other person they say at what age should a woman start breast cancer screening? Legal one inside WhatsApp.
Yeah, so approximately around 45, like way the book say. But if you get anybody when like your mama or any first degree family member who gets cancer of the breast, you can start as early as 40 or even 35.
So if una don't get, if a family una don't know say una don't get one person we don't get breast cancer, una for begin start at
as early
as
30 than 45. Yeah.
As 35 or 30.
35, 40 between 35 for you will start at earlier.
Okay, doctor, this other person say doctor say what is mammogram and how often should it be done?
Okay, so mammogram something like come an X-ray. What would they take for X-ray the breast? Okay. So that one day, if you want the user for the do, now will the use actually with the scan the breast, okay? With the X-ray, not just say with the X-ray the breast. Now like a radiation you pass through for see whether you get any abnormal thing inside. You can do one yearly, then there's not a problem. And not to just mammogram you can use. You can use the ultrasound scan. You can use MRI. But now the day you get time, you don't know whether you use that for.
So this other person they say doctor, are there other screening methods besides mammogram?
Yes. Other screening method is like the other case, you can use X-ray. I mean ultrasound scan. You can use ultrasound scan, you can use MRI also for do your screening process. Then physically, you know, the doctor can examine you, can examine the breast, he take your history.
So this is not the last question. We, in fact, it can be an advice. It can be advice to everybody. We will know we will take all the message. This person say, Emmanuel and Doctor say thanks for the program. How can people reduce their risk of breast cancer? I mean, that's a sheriff inside only.
Okay, so the quite say the risk factors the way I be list earlier on. So the day you know they will change them. So the day they will change them. One, some way they will change the smoking. If you stop smoking, the chances is reduced. Okay? Alcoholism, the chances is reduced. If you left for the do all the time, you want to do X-ray for stop for exposing yourself to radiation, they actually reduce the chances, the risk. Alright? Some they really you know where the age as you grow older. Two, for exposure to the exposure of what hormone, like the one when are that contraceptives, you understand? If you avoid for the take contraceptive pills, we will make your estrogen or your hormone level increase, we will lead to breast cancer, it can reduce the risk. The same thing to hormone replacement therapy. You don't menopause, but all the time they will inject you with that hormone. If you stop for that, the chances are reduced. But there are some, we will change that because your menses, early age, you understand, menarche. Let's say menarche means age where they see first menses. Ideally, for women, supposed for be between 9 to 15 years. Between the ages are normal. Okay? Then, of course, now we will change that. The time we God wants, we make your system now that's they come for you. There are people, they are very unfortunate, they can get out at early as 7, 8. Okay?
So doctor, as we dey wrap up this program, what are some of the brief preventive measures the way somebody would do for preventing himself from getting breast cancer?
Okay, so now just like this one I will explain this one in another way. You understand? You know, smoking is very bad, not to just breast cancer. Okay? Smoking is very bad. There has also system let people they stop smoking. Then too much of alcohol intake, we need for stop. Contraceptives for female. When you want go to prevention, you want do PPA, you want go to family planning, and you go to the correct statistician where they advise you on how and which one will fit you. Okay? They will give you a lot of options and they will assess you. They will, I believe say they will check you, they will know which one will fit for you. Alright? And then not all the time, you know, maybe you get small cough. Yeah, somebody when you go say, patient you can, doctor, me I want to do x-ray. Marker for me. You know, then in a day, let we left out. Let we left for the exposed body to radiation. Okay? Of course, things say those are the one way now modifiable. The one way now not modifiable, way you know we will change them, then they of course it happen. And when it happen to you, you get tendency for let you develop the breast cancer.
So doctor, you get opportunity 1 minute for talk to Fambu, like you watch the camera and talk back people that they listen you. Waiting I go be your general advice to the public on breast cancer.
Okay, so before I thank you very much for listening to this of course program. Now it's very educative something. We really get for continue for the one, so at least we'll try for educate now over waiting at cancer. Do ya when you get notice of any lump that you breast, no sit down with, no go country way. Come to hospital, make them check you, and make them try for give you the proper advice. Waiting for do the how or what about that.
Okay, so plenty. Thank you to you, Dr. Ibrahim Kemon Sise, when na clinical and oncologist at the Salon China Friendship Hospital inside Jue, where do help for Rob month on this topic, breast cancer. I hope say we all don't learn boku from what he don't say. Well, now so the waiting the doctor say for this particular edition, they come to an end. I want to say plenty thank you to Unawe watch and listen this program. Same way so to Unawe contribute. And the other one there with a message, I don't know before read the message and plenty. I'm not going to read all my message because of time. I want to say plenty thank you to my technical team as this program was produced by Joseph Stanley. We will bring the program come to now. Mine Emmanuel Samuel. So we'll meet again next time. That's what I will tell you. Stay glued to the SLBC.